The complications of diabetes are no joke. That's why in this video, we will talk about the 5 common and well-researched vitamins that have already been proven by clinical research to help prevent the complications of diabetes. Because we all know that elevated blood sugar level can lead to stroke, amputation, neuropathy, and even blindness. Stay with me until the end so you will know about the most common vitamin that is usually deficient for people who have elevated blood sugar level. Hi, this is again Doc Cherry, Doctor of Physical Therapy, teaching you practical health tips and home exercise programs that will surely benefit you. I see a lot of patients undergoing rehab due to complications of diabetes, such as, for instance, the case of stroke. And although regular exercise is very important, proper nutrition is of equivalent value. That's why in this video, we will be talking about the 5 common vitamins that have been backed by research to be able to prevent diabetes complications. This is only for discussion purpose and should not replace any personal evaluation by your doctor. Let's begin. Vitamin K. Vitamin K can be present in small amounts from the food that we eat, or it can also be produced by a bacteria in our gut. Once our body absorbs vitamin K from the food that we eat, it is usually stored in the liver and reserved for future use. Now, how can it prevent diabetes complication? Number 1 is very important. It prevents hardening of arteries. Many studies have already validated that one very common complication of diabetes is heart disease. For people who have elevated blood sugar level, they are actually at risk for developing what we call as accelerated atherosclerosis. When we say atherosclerosis, this refers to the hardening of the blood vessel wall. Now, vitamin K would come in handy because of its special role in calcium regulation. In turn, it prevents accumulation of calcium and plaque formation in the blood vessel wall that would allow proper blood circulation to prevent complications in the heart. We have 2 types of vitamin K. Vitamin K1 from plant sources, and the richest source would include broccoli, while vitamin K2 would be from animal sources. Rich source of vitamin K2 would be from milk, meat, and cheese. Now let's talk about B vitamins, specifically B1, B6, and B12, and how can it prevent diabetic complications. Clinical studies have shown that people who have high blood sugar level may also be deficient with what we call as thiamine or vitamin B1. Now, vitamin B1 can help prevent complications because it can prevent kidney damage. The protective kidney ability of vitamin B1 is its ability to protect kidney cells and improve kidney function, which in turn would decrease kidney damage, which is common in patients who are in dialysis. Vitamin B6 and vitamin B12 prevents nerve damage. Vitamin B6, for instance, plays an important role in the production of neurotransmitters. Now, neurotransmitters are chemicals which allow communication and proper functioning of your nerve cells, while vitamin B12 plays a very important role in myelin production. Myelin is the covering of your nerve cells. This is needed for your nerves to function well. In fact, clinical studies have shown that you need to have sufficient amount of vitamin B12 so that nerve healing can take place. To check if you are deficient with vitamin B12, a blood test can be done, and these can be done through a neurologist near your place. The average normal reading is 300 picograms per milliliter. Lower than 200 would mean that you are deficient, and then you can be given with vitamin B12 injection or oral dose supplementation. Richest source of vitamin B12 would be the liver, but you need to eat it also in moderation because it may also elevate your cholesterol level. It is best to consume it in moderation and pair it with other foods rich in vitamin B12 like your meat and your eggs. Alpha-lipoic acid. This is a potent antioxidant that can be seen or that we can get from other natural sources and may be produced in small amounts by our body. Alpha-lipoic acid can prevent the complications of diabetes because it can reduce the symptoms, the pain, numbness, and tingling sensation caused by neuropathy. This is done through the two benefits of alpha-lipoic acid because it protects the cells and it improves blood flow to the nerves. Now, blood circulation is very important so that nerve healing can take place. Recommended daily allowance for alpha-lipoic acid so that you can experience relief of symptoms caused by neuropathy is between 600 to 1,800 milligram per day. You should not have a higher dose more than that because it may also give you side effects. Natural source of alpha-lipoic acid would be broccoli, spinach, and your organ meats. Before we continue about the two vitamins that can help prevent complications of diabetes, I would really appreciate it if you can take only 1 second of your time to please click the like button below if you think that this video had been helpful or if you think any videos in this channel have been of help to you. Thank you very much. I really appreciate it. Vitamin C. We all know that elevated blood sugar level can lead one being immunocompromised. Vitamin C is very important because it prevents infection. This works in two ways. It can lower your risk of having infection and it can lower the severity of the infection. Vitamin C is helpful in infections like urinary tract infection. Because do you know that women who have high blood sugar level have an increased risk of developing UTI or urinary tract infection by as much as 29%? How do we prevent urinary tract infections? Keep yourself hydrated. Always empty your bladder and practice good hygiene by wiping from front to back. Also, be mindful about the use of panty liners because sometimes this can lead to UTI. What are the symptoms of urinary tract infection? One may experience fever, one may have pain upon urination, blood in the urine, and even low back pain. If you have experienced any of the symptoms, please visit any OBGYNs near your place so that you can be given an antibiotic. Vitamin C can prevent skin infections, which is common for people who had been diagnosed with diabetes. Now, these can be bacterial and fungal, and in fact, cellulitis, wherein the skin becomes red, swollen, painful, and warm to touch is also common in people who have high blood sugar level. This affects the deeper layer of the skin, can happen in any parts of the body, but usually affects the lower leg. And lastly, vitamin C is also very important to prevent respiratory infection because clinical studies have really validated that people who have high blood sugar level are prone to developing pneumonia and are prone of hospital admissions. Recommended daily allowance for vitamin C is 90 mg per day. Do not exceed more than 2,000 mg per day because it has potential side effects. If your concern is hyperacidity, sodium ascorbate, the non-acidic form of vitamin C would be helpful for you. But it is still best to get your vitamin C from natural sources because of its other added benefits. Best source of vitamin C would include your guava, papaya, strawberry, kiwi, citrus fruits, and even moringa, as what we have discussed in this video here. Lastly, let's talk about vitamin D. Do you know that clinical studies have shown that those people who have high blood sugar level, they are actually mostly deficient with vitamin D? Mostly because of lack of sun exposure due to sedentary lifestyle or due to kidney dysfunction. Because your kidneys are needed to actually process the inactive form of vitamin D to its active form. Now, how does vitamin D help prevent complications of diabetes? It prevents blood sugar spikes. Now, this is very important because actually this is the main reason and the main problem for diabetes. Vitamin D in many clinical studies have actually proven that it can improve insulin sensitivity, wherein your cells are able to utilize insulin better, preventing blood sugar spikes. Vitamin D also plays a crucial role in protecting the beta cells. Now, beta cells are specific cells in the pancreas that produces the hormone insulin, which is very important for diabetes management. Lastly, vitamin D also prevents what we call as osteoporosis. Do you know that clinical studies have now validated that people who have been diagnosed with diabetes are also prone or at risk for developing osteoporosis, wherein the bones become brittle and weak? Recommended daily allowance for vitamin D is 600 IU per day. And if you choose to supplement, vitamin D3 is better because it is well absorbed by your body. Natural sources would be sun exposure. Expose yourself under the sun 10 to 30 minutes between 10 to 3 o'clock in the afternoon, a couple days a week. You can also have natural sources of vitamin D from fatty fish like salmon and tuna. These are the 5 well-documented vitamins that can help prevent diabetes complications. If you have reached the end of this video, please comment beet sugar in the comment section below. If you want to know about the top 9 symptoms of vitamin B12 deficiency so that you can visit a neurologist near your place, I have a video here. Check on it. Let this video help and guide you. Should you have any questions about this video, please comment down below because I would really get back on you. Thank you very much for watching. This is again Doc Sherry. Stay safe, stay happy and healthy. God bless you. I'll see you on our next video.